screen. Please be patient. Jyoti, just do this, increase this slideshow. Go to slideshow and start the presentation.
Here we are discussing now the comparison of, sir, whether this is getting recorded. Yes, I think yes. So here we are going to discuss about the comparison modified lung ultrasound score with the classical lung ultrasound score, and the similar type of result have been bought for the classical lung ultrasound score. So in
Jyoti, you're not audible.
hello.
Is it only to me or yeah, I can hear you.
Am I audible?
Yes. Yeah,
Yes.
you're audible. You're audible. Go ahead. Go ahead.
So here we are trying to correlate the modified lung ultrasound score with the clinical outcome. What are most important clinical outcomes of BPD? That is respiratory support at 40 weeks of postmenstrual age. Modified lung ultrasound score was more than the mean, and the baby who had a higher modified lung ultrasound score at 36 weeks of gestational age, they are having very high chances of requiring the respiratory support at 40 weeks of menstrual age, post-menstrual age. And similarly, the oxygen requirement at discharge was also well correlated with the modified lung ultrasound score, and where we can see that if the baby had high modified lung ultrasound score, had high chances of requiring the oxygen support. And similarly for the steroid, also those babies with the high modified lung ultrasound score, the babies had higher chances of requiring the postnatal steroids. And the p-value of these are significant for all the three clinical outcomes. And as comparison with the from modified lung ultrasound score with the classical lung ultrasound score, the similar type of result have been brought for the lung ultrasound score, classical lung ultrasound score also, but only difference was oxygen requirement at discharge. Sorry, the oxygen requirement at the discharge was not showing the significant p-value, which is very less 0.34. And so what the author is saying, that the classical lung ultrasound score is very good in assessing the short-term clinical outcome of BPD, but they have weaker co-association compared to the modified lung ultrasound score. And the ROC score compares the modified lung ultrasound score. This is a red line is showing modified lung ultrasound score, and green line is showing classical lung ultrasound score as the second part of the objective. So here you can see the A curve, AROC curve is for moderate and severe BPD, and the B is for severe BPD. In A curve, you can clearly see that the area under curve from modified lung ultrasound score is more, and in B image, you can see, just estimate that the area under curve for modified lung ultrasound score is more. However, for the moderate to severe BPD, we got a significant p-value of 0.03. However, in severe BPD, they didn't get a significant p-value. That means modified lung ultrasound score is better than a classical lung ultrasound score in evaluating the moderate and severe BPD. And in this slide here, we can see every individual outcome, like oxygen requirement at 40 weeks of postmenstrual age, oxygen requirement at discharge, postnatal steroid treatment, and duration of mechanical ventilation more than 14 days, and supplemental oxygen more than 16 days, and length of stay more than 90 days. And as you see clearly in all the figures, that the modified lung ultrasound score is having higher area under curve as compared to classical lung ultrasound score. And you can see that all the p-values are significant. All the p-values are significant. That means modified lung ultrasound score is superior to the classical lung ultrasound score in identifying the short-term clinical outcome for BPD. And at the last, to find out the cutoffs for modified lung ultrasound score, they found out that for moderate to severe BPD, the score cutoff will be more than or equal to 14, and for severe BPD, the cutoff will be more than or equal to 16. And after doing the study, what they found was modified lung ultrasound score is definitely has a significant correlation with the short-term clinical outcome of BPD, and also has a better reliability for short-term clinical outcome compared with the classical lung ultrasound score. And now what they have said, that basically we cannot clinically very well diagnose BPD. We need support of imaging. So previously we, like now also, we use X-ray, which gives radiation exposure and is also poor correlated with the BPD. And CT scan also has a higher radiation exposure and also not available in all places with the high radiation exposure. And pulmonary MRI is also not available at all the ICUs, and it's cumbersome to do also. Lung ultrasound is radiation free and portable, non-invasive, and available in most of the NICUs in developing countries also. So this is the best modality to identify BPD. In BPD, as we previously discussed, that the effective part of lung is posterior aspect, besides the vertebra and closer to the diaphragm, and not anterior part. So what classical lung ultrasound scores can only the anterior part and lateral part, as we see before. And we are more interested in scanning the base of the lung. So modified lung ultrasound comes in picture for this. So in this prospective study, we demonstrated that the modified lung ultrasound score is more accurately assess the BPD diagnosis and had better reliability for predicting short-term clinical outcomes compared to the classical lung ultrasound score. So golden point is modified lung ultrasound score more than 14 is significantly correlated with the worse outcome independent for the gestational age. And the cutoff value for modified lung ultrasound score may also represent an easy tool to estimate the BPD severity and guide for further examination and intervention. So the limitation for the study were more recent BPD definition is not used, then pulmonary vascular disease and large airway disease we cannot rule out on the lung ultrasound, and the ultrasound is also operator dependent, and the short-term clinical outcome were censored before the discharge in this study. So further longitudinal studies are needed to investigate the relationship between lung ultrasound imaging and the long-term outcome. And the conclusion is that modified lung ultrasound score at 36 weeks of post-menstrual age correlates well with the short-term clinical outcome, and the results used to evaluate the BPD severity of preterm infants and promote the improvement of current BPD definition. So CASP checklist for this study was like quite good. Well, so first question was there a clear question for the study? Yes, it was there. Was there a comparison with an appropriate reference standard? Yes, it was with the appropriate reference standard. And did all the patients get the diagnostic test and reference standard? Yes. Could the result of the test have been influenced by the result of the reference standard? Yes, the clinician was blinded to the lung ultrasound score, and the both investigators were blinded to the clinical condition. So it was good. And is the disease status of the tested population clearly described? Yes, they have described. And were the method for performing the test described in the sufficient detail? Yes. What are the results, like sensitivity, specificity, and the results presented in such a way that they can work out? Yes, they were good. And how sure we about the result, consequences and cost of the alternative performed. Yes, all the results have been presented with a good p-value and with a 95% of the confidence interval. And can result be applied to your patient and population? Yes, we can apply to our patients. And can the test be applied to your patient or population of interest? Yes, we can apply. And were all outcome important to the individual or population considered? So yes, and what would be the impact of using this test on your patient and population? So yes, definitely modified lung ultrasound score will be a boon in early diagnosis and early detection of BPD. So now we would like to discuss the various videos which we have created in our NICU unit to give you a better understanding of modified lung ultrasound score. Over to you, sir. Thank you. Over to you, sir, for videos.
So excellent presentation, Jyoti, and I am really proud that you have presented very well. And yeah, I have got one question in the chat box that no, we cannot apply. I really totally agree with you, because we need further studies, we need further evaluation, we need meta-analysis, and we need a higher evidence in order to prove that the modified lung ultrasound score is better than conventional or classical lung ultrasound. But to be, I will still keep it with me, and I will give it to the crowd that lung ultrasound is very important modality for you to predict early BPD, as well as to intervene with the postnatal steroids, because we don't have any other good modality. Plus, although yes, the clinical part is very important, but on the same hand, lung ultrasound will help you definitely in knowing the condition of the lung, in order to predict as well as to assess the short-term clinical outcomes at 36 weeks of postmenstrual age. With this, I will share my screen and we will just see the 4 videos which we have created in our unit to make you well versed with classical lung ultrasound and modified lung ultrasound. So I'm sharing my screen, just be patient. Jyoti, you need to enable me to share my screen.
Okay, yes, sir, done, sir.
Okay, thank you. Okay, so let's go to the videos. Is my screen visible?
Yes, sir. Yes.
Okay, so we'll go to the first video. Uh, if there's any issue with the video, just please promptly tell me so that I can rectify. So I'm playing the first video. Please listen it to carefully. Today, I think this is hanging. Just a minute. Is it working?
Sir, if you stop your video, your own video, then it
Okay,
might open.
sorry. Okay, right. A short video where we will tell you about the basics of lung ultrasound and what is modified lung ultrasound score. So this is a linear probe, as you can see, and this is the pointer for the linear probe. And here you can see that it is written as 12. That is the frequency of the linear probe. Now, when we use it in the lung ultrasound, we have to place either the probe in a perpendicular position to the ribs or parallel to the ribs. There are two positions, either perpendicular or parallel. And the first place where I'm placing the probe is the upper anterior. This is the lower anterior. And when I place on the lateral side, this is the right lateral side to view the lung. Similarly, on the left side, this is the upper anterior, this is the lower anterior, and that is the left lateral. So 1, 2, and 3 on one side, and 1, 2, and 3 on the other side. The total of 6 region approach is used for conventional lung ultrasound or classical lung ultrasound scoring. Thank you. Okay, next moving to the next slide. Today, this is a short thing. Yeah. And now this is the curvilinear probe. You can see this is a curvilinear probe. So as per the article, curvilinear probe should be used in order to do the retrodiaphragmatic view. That is the base of the lung to view. We should use the curvilinear probe. So what we have to do in this baby is when we want to do the other two images of modified lung ultrasound scoring, we have to place the probe with the pointer towards the midline, and we have to place the probe below the intercostal margin, that is in the retrohepatic view. So we have placed the probe, and we just tilt the probe towards the base of the lung. So we are able to see the base of the lung. So as you can see in the image here, so this is the heart. Okay, if we move towards this side, we can see this is the lung. So this is the liver, and this is the diaphragm, and this is the base of the lung, where we can see that there is a lot of B lines are there, and these are compact B lines. The A lines are absent, and in between we are getting simple B lines also, but most of the time it is a compact B lines. The consistency, you can see there's a difference in the consistency. This is the liver consistency, this is the lung consistency. So there is a difference, but what we see is simple B lines and the compact B lines, and this is the liver. So this is retrohepatic view of the modified lung ultrasound. Okay, next, now going to the next slide. Similarly, for the left side of the lung, in order to view the base of the lung, we have to use again the pointer towards the midline, and we have to hook the probe below the intercostal margin. And we need to visualize this base of the lung using this view. So when you see the image, again here you can see this is the spleen and this is the lung, and the
So video not moving.
this linear probe. So you can use for retrodiaphragmatic views on both on the right side and the left side. You can use the linear probes also to see the base of the lung. Thank you. Then just one more. Be patient for the last video. That's just a summary of it. I think that I didn't. Okay, fine. I'll summarize myself. That video was not working. So basically, two probes can be used: the linear, curvilinear, and then next one is the hockey stick probe. If in your unit you have a hockey stick probe, you are very lucky because that is the best probe. But still, you can manage with a linear probe, and as you can see, the images were crystal clear. And this is how you do the classical lung ultrasound scoring and the modified lung ultrasound scoring. So only thing you have to remember in the modified lung ultrasound score is you have to go beneath the rib in an up scan, and you need to scan the lung which is at the base, that is just above the liver, and on the right side and on the left side just above the spleen. And this way you can scan the base of the lung, and then on that basis you can classify the modified with the modified lung ultrasound score whether the baby fits in a severe BPD or moderate to severe BPD. Still, I would say I would not confirm it, but I will have an idea. I need further evidence in order to confirm myself that modified lung ultrasound score is better than classical lung ultrasound score. But nowadays, please remember there have been n number of studies where they say that the lung ultrasound is very, very important and has been increasingly being used in all over the NICUs in the world to diagnose RDS, to diagnose meconium, to diagnose atelectasis, to diagnose BPD, and also to plan postnatal steroids. What my dream project would be with the help of the modified lung ultrasound score, if I can predict the use of steroids, and if I can wean the baby faster, and I can send that baby fast a bit earlier without the complications of BPD, that would be the excellent use of lung ultrasound in RNICUs. With this, I think we will end up. Sorry for a bit longer presentation. If there's any questions, I think the chat box is empty. But if there's any question, then you can please, I'm open to the questions, me and Jyoti. We will wait for another 1 minute because I think it's already late. Okay. I think there are no other questions because number of the participants are also coming down. It's now 11. So thank you, Jyoti, for an excellent presentation. And thank
Thank
you
you, sir.
all the listeners for being so patient and be listening to the presentation very patiently till the end. And I hope this gives some important knowledge, especially the statistics and the lung ultrasound. We are signing off now. If there's any questions, you're still open. Please share it on the All India group. I'll be happy to answer to your questions. Thank you.
Thank you all. Thank you, sir.
Thank you, Jyoti.